Hello, and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Power, the editor of GP Online. Today on the podcast, I'm speaking to GP Dr Simon Opher, who was elected as the Labour MP for Stroud in Gloucestershire in the general election in July this year. Simon was a GP partner in his constituency for 30 years before standing in the election. Coming up in this conversation, he talks about why he wanted to become an MP, what being an MP involves day to day, and some of the challenges he's faced in this new role, including going from being in one of the most trusted professions as a GP to the least trusted as a politician. We also talk about what role he thinks general practice will play in Labour's plans for a neighbourhood NHS, how he hopes general practice will improve over the course of this Parliament, and why he sees standing up for general practice as a key part of his new job. I'm really pleased to be joined on the podcast now by Labour MP Dr Simon Opher, who's a GP in Gloucestershire. He became an MP after winning his seat in the general election in July this year. Thank you so much for coming on the podcast, Simon, and thank you for inviting me to your office in Westminster.
I'm delighted to be asked by GP Online to give an interview.
Before you stood to be an MP, you'd been a GP in Stroud for 30 years and you were a GP partner in the same practice for most of that time, weren't you? What made you decide to stand for election?
It was strange because I've been involved in trying to organise sort of locality care for a long time and trying to improve health outcomes. And I realised that we were coming up against a brick wall, which a lot of health outcomes are based on political things, not medical things. So like inequality, for example, is an incredibly strong driver of ill health. And there's all those worrying statistics about, the better off live on average 10 years longer than the less well off. So I realised that to really improve people's health locally, I needed to jump into politics, really. That's how I initially got involved. So now I'm trying to make a difference sort of from the inside, if you like.
Are you still doing GP work now? How's that working?
Yeah, I was going to do a session a week, but this job's so busy that I've actually just do about one a month now. In my old surgery, I've had to resign as a partner, which is a real shame because I have been there an awfully long time, but it was right for the rest of my partners. I was certainly absent partner for up to a year before, actually, and so they were very good to me. So now I'm just doing it on a sessional basis, but I love it when I get in there and see my old patients and do what I sort of know how to do, and I've probably been taught how to do it, really.
How do they react to you now when you come back?
What tends to happen is we have it as an emergency surgery, so it can't be booked into by my old favourite patients. So actually a lot of them don't realise I'm an MP as well. They just treat me as a doctor, and that's what I really like about it, because one of the things as a GP, as all our GP listeners will know, is that you really get to hear what's happening with the health service much more honestly than managers talking about it and politicians talking about it. So you get to hear the real bottom line of what's going on and people having to wait for such an awfully long time for operations and stuff. So I really enjoy that, and at the same time I'm just a doctor and helping people in the way I've done for the last 30 years.
How did you actually get involved with politics? How did you end up becoming the Labour candidate for Stroud?
So I joined the Labour Party about 8 or 9 years ago, and so I've always been sort of interested, but as a full-time GP, you don't have that much time. I did a little bit of canvassing, that's knocking on doors and chatting to people in the 2019 election. And then when we got the result of that election, I already knew at that time that the health service was on the slide. There was great big long waiting lists, and things just weren't working well. And when they got re-elected, I felt so angry about it, actually, that I discussed it with my wife quite a lot, and she said, well, you're going to have to do something about it. You can't just moan about it. So when the call came in to apply to be a candidate, I said, I'll just give it a go and see what happens. So, and actually what's interesting about it as a role is that MP and GP, they're sort of quite similar. I mean, basically, we hold surgeries like a GP surgery, except it's not medical, it's other issues. You have to be part of the community as a GP and an MP. And probably the most important thing is about listening. As an MP and a GP, your most important skill is listening, and that doesn't change between the two professions.
What's it actually been like coming to Parliament? I mean, you've been an MP since July. What do you make of working in Parliament? What have been the first few months involved?
Right, so you have an election on Thursday, you get the result early Friday morning. on the next Monday, you have to start in Parliament. So it's an absolute whirlwind of change. And essentially, you, as an MP, you have two jobs, really. You have your parliamentary stuff. So you're talking in the chamber, you're meeting people, you're on committees, etc. And then you go back to your constituency. And that's where you deal with people, local people with their local problems and such. And it's almost like two separate things. So you have to set up an office in Parliament and you have to set up an office in the constituency. And it's a bit like setting up a small business. So you get about 250 grand to employ staff. You have to get a building. You have to appoint the staff. So it's really very, very complicated. And then you have to get to know how Parliament works. And Parliament's just a very weird place. It's a bit like Hogwarts, really. There's all sorts of weird rooms. And there's something called the table room, which I thought, well, that's a bit weird. And that's actually where you table a question. You have to learn how to get a question into the House of Commons, and that's quite complicated actually as well. So I'm just beginning to learn how it all works as such. And then the other thing I'd say about it is I remember that stage when I was when I just qualified as a doctor and I was just starting my house jobs, as they were called then, and you thought you were going to turn up in the hospital and be this sort of all omnipotent doctor who could control everything, and you realise when you arrive in hospital that you're the lowest of the low, and that's the same as an MP. You come in and actually you're a backbencher. You have to do your time and work up in it, really.
There's quite a lot of new Labour MPs there as well, so there must be a group of you trying to work it all out together, are there?
Yeah, no, there's enormous. There's something like 350 new MPs. Most of them were Labour and Lib Dems as well. There's a lot of staff who support us, which is great. And the one thing about the new Labour cohort is they're significantly younger, significantly more female. I think 46% are women, and really from really diverse ethnic backgrounds. And the guy who sort of looks after us and stuff, he said it's like a huge wind has blown through the Commons, and now we've got this really much younger cohort. We're all learning the ropes, but it does feel really exciting as well.
What does a day-to-day job involve? How much time do you spend in Westminster compared to down in Stroud?
It's probably better to describe a week. So we're expected to start at 2:30 on a Monday afternoon, and we work till 10 o'clock in Parliament. And then we're in Parliament for Tuesday, Wednesday and Thursday. And then we go home on Thursday night, and we're meant to work Friday. And so I try and have a day off a week, which is usually Sunday. It's one of those jobs that everything encroaches on your time, and it's very difficult to maintain boundaries. So that's what the week's sort of like. So I'm in Parliament. So, for example, I'm meeting some GPs tomorrow talking about neighbourhood health centres. That's something that our government wants to sort of develop. And then I'm also chair of a number of all-party parliamentary groups on health and something called Beyond Pills, which is, over-diagnosis and over-medicalisation of life, which is something that a lot of GPs feel, I think. So you run those sort of committees, and then when you get back to Stroud, people have problems with things like parking or planning or lots and lots of different issues. Sometimes they have complaints about the health service, which is quite interesting as well, that you have to handle. So anything else really from the constituency comes in at that time. I've got an office of people that deal with a lot of those complaints, so I sort of go down and sometimes have to meet people to discuss issues.
Do you find that you're in demand because you're a doctor? Are people kind of quite keen to have your expertise on some of those things?
Yeah, in some ways they are. And in some ways, what was interesting is that in some of the departments, they don't necessarily want you around so much. That's what it felt like. So, so certainly I'm if people have got issues concerning the health service and particularly primary care, they would come and talk to me about it. But it doesn't seem to be a ticket to a senior role at all, really. So I'm quite keen to make sure that people understand what the problems of general practice are, because it is a massive issue. And when you knock on people's doors, a lot of people talk about GPs and the parlous state of the NHS. So, I am quite involved in that. I've just been to a meeting, for example, about preventative health and about getting people to walk and cycle more, and that's with Professor Chris Whitty and the Department of Health. So I can put in my GP view of how can we get kids cycling to school and that sort of thing. So it's quite exciting because you realise that you can make a difference to a lot of people's lives by changing some regulations, putting more money into cycling and that sort of thing. So, I find that really exciting.
When you were standing in the election, during the election, what were the big issues that people were talking to you about when you were out trying to get their vote?
Actually, the NHS was one of the major issues, probably top two for almost everyone. The amount of wait they have to do for, hospital appointments and operations, and also, to be honest, also what's happened to GP services recently, and that was a big issue. We had a lot of chat about how you make an appointment, for example, with the GP. That was a major issue. A lot of older people aren't happy with the access via, Anima and that type of AI type systems, or indeed using AccuRx to have to fill in stuff. So I think we do as GPs need to be mindful of the fact that some people find that very uncomfortable and they just really want to speak on the phone to a receptionist. And so we mustn't design them out of the system. And I got a lot of complaints from constituents about that. And I was able to sort of push back because I know how hard it is in general practice at the moment and what stress we're under. We need to really develop what we're doing. And one of the things that Wes Streeting does talk about is getting care out of the hospital into the community. And for people of my age who've been in it for 30 years, I've heard that quite a lot.
So have I.
We've really got to make it happen this time. And that means putting money into general practice and community care. Because what's happened in the past is they've paid lip service to community care, but we haven't given us any funding to do anything with. So I'm really making sure that our voice is heard in Parliament.
Are you confident that the government will be able to deliver on that ambition to move more funding into primary and community care? And how do you think it's going to be able to do it?
I am confident because actually, the people involved in the Department of Health, the ministers and Wes Streeting himself, the Secretary of State, they are committed to this and that they do understand what's going on in the health service. I have had dealings with politicians in the past and I'm going, I don't know what service you're talking about, but it's not the same one as I work in. But I do feel that they do have a commitment to do that. The other thing is, I think politically we have to deliver on the NHS, otherwise we won't get another term, because it's such a big issue. So that adds a bit of weight to what we're doing. There are really important things like waiting lists. We need to crack on with those and try and clear them. And I think we will do. The only thing I would say is to transform the NHS, it's not going to be certainly not going to be in a year. It's probably not going to be in 5 years. We can start a change happening, but actually, really, we need to make a real sea change. It's going to take sort of 10 years. So we're really starting to do that, but it's going to take a while because, as everyone who works in the NHS knows, it is in a parlour state at the moment. The buildings need renewing, I would say. The whole system needs a bit of a tweak as well, because I think that too many people go to A&E, for example. Too many people call paramedic ambulances when they don't need it. So we need to sort of get hold of the problems and really sort them out from the bottom up, I think.
With this kind of move out of hospitals and into the community, do you see there being more money coming into general practice as part of that? Because obviously one of the biggest problems we're facing in general practice at the minute is really quite serious underfunding of the core GP contract. We've got this terrible situation at the minute where lots of GPs are struggling to find jobs as they're qualifying because of that problem with underfunding of core general practice. The BMA is really pushing for an increase in core funding. I mean, do you think that's something that's likely to happen over this next Parliament?
Yeah, I think it's got to happen. I think these are difficult decisions that ministers have to take. To transfer care into the community, we have to get the funds to do that. We can't, and as everyone knows, if you discharge someone early and you haven't got the resource in the community, they just bounce back to hospital. So we have to make sure that this is resourced, and I think we also have to make sure that funding goes into general practice so that actually services can improve and get back to what they were really 15 years ago, where we were, I think, properly funded. I feel like general practice has been sort of politically neglected, really. And I think the advent of PCNs and the ARR roles, they're probably the right idea, but the fact that they were so trenchant about not putting them into frontline care meant that actually frontline care has really spiraled downwards, and we haven't got enough resource to see patients. So in my practice, we got a pharmacist who's fantastic. Probably our safety in prescribing has improved no end. We've also got a young person's care coordinator who's also fantastic, but we've got 2 or 3 weeks wait to see a GP because we ain't got enough GPs. So I think we've improved the quality, but we've taken our eye off the bottom line, which is we need to see patients quickly. And if we can do that, then I think that a lot of problems can be averted, reasonably quickly as well. And, preventing hospital admissions will come from that, certainly. One of the things that's never discussed, I think, in the NHS in general, and particularly in primary care, is the demand side. It's all about supplying appointments and that sort of thing. So I'm working quite closely around self-care, because I think people just, they get a headache and they come in to see the doctor. And, headaches are sort of normal part of our existence, I think. And, the number of headaches that turn out to be a brain tumour is vanishingly small, and yet everyone gets anxious. So people need to take a bit more responsibility for their health. And that's not a very good political message to give out, to say, actually, you're using it a bit too much. But it's quite clear, I think, that, from working in general practice, that people are probably coming in too early and they're getting fed lots of anxieties through the internet as well. So we need to hit the demand side a bit as well, I think.
What else do you think Labour will do to support general practice over this next Parliament?
There's commitments around paperwork and bureaucracy. And again, I've heard that before, but one of, I think, my roles in Parliament is to say, you said you're going to reduce bureaucracy, so how are we going to do that? And I think it's really imperative that we do that, because I think we spend an awful lot of time in general practice doing stuff that we know is sort of marginally helpful, but it's enormous use of our time. So some of the QOF targets are, they're obviously evidence-based to a degree, but we're having to spend a huge amount of effort to get to these targets, and yet we can't see patients for 2 or 3 weeks. So we've got to reverse that, and that might mean that bureaucracy goes down. That might mean some of the targets get dropped a little bit, so that we can properly develop a service again and build it up from there. So that's one of the things, is getting rid of red tape. And I think also we must improve mental health provision. If we don't do that, a lot of my work is patients with mental health issues, and it takes up an enormous amount of time. One of the things that really shocked me, actually, is that about 8 million people in this country are on antidepressants, SSRIs. 8 million in England, that is, not even in Wales and Scotland. And that's partly because so much mental health is coming into general practice, and yet we haven't got a resource to, signpost them to, who will see them quickly. The wait for mental health assessments around our way is about 6 months. That's just not good enough. And therefore, people are getting put on tablets that perhaps don't need to be. That's really important. It's not good for them. It's not good for anyone, because if you put someone on a tablet, they'll also have to need a review in a month's time. So you'll double the number of appointments you need. So we must get mental health services. We must get them alongside general practice. And I think that's something that the Department of Health do get, and I'm constantly reminding them how important mental health is.
Do you see yourself as developing a career in Parliament along that line, maybe going towards a ministerial job, or getting more involved in committees and things? How do you see your job as an MP developing?
Yeah, I think I'm an agitator, really. One of the ministers described me as a sort of agent provocateur, really. So I tend to say things as I see them, and that doesn't really get you much favours in terms of ministerial uplift. So no, I don't think I'll really make it to minister level. Also, I'm a bit old. I'm 60 now. So in those terms, these things take time, actually. And I noticed that, to get into the ministerial thing, you have to be both a loyal Labour Party member, but also be, you need to do the time, really, to get in there. So I don't think, I haven't got much aspirations for that. I think my role is to stand up for general practice. I think general practice is absolutely the bedrock of the NHS. And actually, I think one of the main problems with the NHS now is general practice is in such a parlous state. We used to absorb so much pressure that was out there. So even when the hospitals were failing, if general practice was healthy, we could sort of keep it going, but I don't think we can at the moment. So we must rebuild it. And if that's the only thing I do and keep prodding them to do it, then I'll feel really pleased with myself.
Well, yes, I'm sure loads of our listeners would really appreciate you doing that as well, actually. Coming on to this idea of the neighbourhood NHS, I know that this is something you mentioned earlier, and I know you've said before, is something that you really like, this idea of having a neighbourhood NHS, and it's pretty key to Labour's manifesto for what it wants to do with the health service. But how do you actually see that model working in practice? What would it look like, and where does general practice fit in with all of that?
I'm really interested in people's ideas. That's the first thing, because I'm not saying that I've got all the answers. So they've launched this consultation that I think is a really good idea. I know people are a bit jaundiced about consultations in general, but I'm very happy to hear from GPs to say how they see the sort of neighbourhood health centres developing. How I see them developing is, I think that, the GP partnership, the building, the surgery is the centre of primary care, and I think we should build out from there. So I think that, when I started, when was it, 1995 in practice anyway, we had our district nurses on site, we had our health visitors on site. And so if we were a bit worried about someone who's terminal or palliative, we'd just nip upstairs and say, what do you think? And that physical co-location is really important. We lost that. So if we can get that sort of thing back, that will involve some investment in buildings. We need to pull back in 111. I think 111 is a disaster for the health service, and we need to take control of that sort of front door. At the moment, if you want care from the NHS, there's so many ways of getting into it. There's GPs, there's GP out of hours, there's MIUs, there's 111, and there's A&E, and there's also, you can dial 999 and get a paramedic. So there's about 5 or 6 ways of getting there. As an NHS and also as a medical profession, we've lost control of that. Neighbourhood health centres could bring that back so that we were all co-located and all work with each other, so that sometimes you go and see someone, you go, they need an ambulance, and there's no ambulance because the paramedics are seeing someone that really should have come into your surgery to see the GP. So we need to sort this out, and I think neighbourhood health centres could really help with that. And the other thing I'm quite excited about is getting social care on site as well. Also, all the other voluntary sector organisations that could really help us as well to be on site. So I see the general practice as the centre of a neighbourhood health centre, but I think we need investment in buildings and bringing everyone else back on board.
Buildings are a major problem, aren't they, really? Do you think there's money coming for that at some point?
Well, there has to be, doesn't there? If they want neighbourhood health centres, they're going to have to invest in that. One of the problems with funding in general in the NHS is that it's all gone to hospitals recently. The enormous amount of the funding has gone out of general practice to hospitals. So even though we do like about 90% of the consultations or 92%, we only get about 9% of the funding. And in deprived areas, they get even less. So that's another thing we need to get our heads around and actually fund GP practices in deprived areas better than they are. As everyone who works in more deprived areas, that's where the workload really is, and you have to do a lot more work just for the same number of patients. So we must reverse that funding sort of gradient, if you like. We have to have more buildings. I think there's a commitment to that, but that's why it's a 10-year plan. You can't build something in a year. And I think what we also need to do is, if someone's got an idea, we need to properly test it. So the PCN idea was just thrust upon us. It sounded all right, so we all went along with it. And I'm just sick of that sort of stuff. We need to do a couple of pilots, see what works, don't do the same mistake again, and then roll it out after that.
Do you see neighbourhood health centres, do you see them as being the same thing across the country, or could they be different in different ICBs? Or do you think for everyone to get it, it has to be a similar model so everyone knows what they're getting?
I think it has to be different. I think the beauty of the partnership model in general practice sort of works, I think. This sort of came about when in the inception of the NHS, and it was a way of working around issues. But actually, it's a great model. It's a sort of independent but contracted to the NHS is a really good setup, because it means that you can do things how you want to do them. And a lot of areas, it will look completely different. And the other thing is, we don't have to have everything co-located. You can have a virtual location, but it has to be of the same sort of control, if you like. You have to have control. So that might mean that they're not on the same site, but they're in sort of virtual co-location.
Do you see this all being stuff that is added into the GP contract potentially? So GPs will get more money to sort of start employing these roles and extra things? Or do you just see it more as people having to work together?
The thing is, at the moment, if you think about it, the 111 contract is quite valuable, but we have no control over it. So if we're going to do that sort of work, we need that money as well. We need the funding. So any extra work, you have to have the funding that comes with it. If we're going to start working with ambulances and coordinating, then we need that money as well. So certainly, we're all sick of having more work thrust upon us, and it's always been the way last 30 years actually that's happened. So we mustn't let that happen, and I don't think it will happen. I think the funding will follow the workload actually in that way. I've got no special portal into the Department of Health, but this is I've been to lots of meetings, and it seems that that's the sort of direction of travel anyway.
Everyone's just hoping at the minute things will get better. Obviously, we've got to wait till this 10-year plan comes out to find out a bit more detail of what's going to happen. But do you expect by the end of this Parliament that we'll still be saying general practice is in crisis? And if not, what things would you hope to be in place that could indicate that we're kind of starting to move in the right direction to save general practice?
I do think that we need to look at getting funding and support and rehab out in the community. And I think that will happen. I think there will be more doctors in primary care. So there will be, tangible differences. It won't be the complete model. I think to get re-elected, actually, we're going to have to make some substantial improvements in primary care, and I think we will as well. So, more doctors, more appointments, I think, and also A&E as well. If we can get a proper functioning A&E, that will really help general practice too.
You've been a partner for a long time and you've talked a lot about the importance of partnership. Do you think the partnership model is critical to the success of general practice? And if so, what do you think GPs and others need to do to convince the government of that and ensure it looks after the partnership model?
Like I say, I think it's a weird model, and you probably wouldn't design it, from scratch, but it sort of works. And I think it's the independence of the contractor status that's really important. So it means that you can do what you want. And almost every GP I've ever met is about delivering better care for their patients. They're really particular and quite sort of possessive about that, and that's what partnerships do. They say, we're not going to do that, that's stupid, because it doesn't help anyone. So most of their decisions are based around what helps their patients. So that's why it's a good model. I remember we used to have coffee at 11 on Monday, and a GP would come in and go, I'm fed up with doing this. And then we'd all sit around, and within 10 minutes we'd agreed to change what we were doing, and that afternoon we'd implement the change. Now, you try and get that in a big organisation, it takes years to do that same thing. So small is beautiful in that way. You make quick changes that benefit patients.
You must find it quite different from going from that kind of environment to working in Parliament, and particularly in a party where you've kind of got to stick to the whip and things like that. Have you found that?
Yeah, no, it is difficult. And what I realised is that I've worked all my life as a GP, really, and I've been free to do what I want. And tell you what, people out there, it's a real fantastic thing that you shouldn't take for granted. Because, at the moment I have to toe the line a bit, and that's tough, actually, because sometimes there's things that you don't entirely agree with, but you have to go along with, and that's not something I'm really used to. So it's really valuable, and I think that's what takes me against a sort of salaried service, because people will then have the right to tell you exactly how you do things, even though you know it's not the right way to do things for your patients particularly, or whatever. So, that independence is really, really valuable, and we mustn't lose it.
Yeah. Are there any changes you think we could introduce to encourage more GPs to become partners? Because obviously that's one of the big fears at the minute, is that partnership is just not very attractive to GPs at the moment. So what could we do to make it better?
I think the things that put people off partnerships are, there's a number of things. I mean, one of the things is if you're a partner, and when your partner leaves, the way to improve your income is not to take on another partner. One of the things that we used to have is something called a basic practice allowance. So you only got that if you were a partner, and that sort of incentivized you becoming a partner. So I'm not suggesting we bring that back, but there needs to be some financial incentive to be a partner. And I think the second thing that puts a lot of people off is the building, ownership of the building. I've personally been involved in quite a lot of that, and it's so time consuming, it's quite stressful, it's financially stressful. So I like owning our buildings, I think that's quite a good advantage, but on the other hand, getting new partners in, we need to streamline that process and make it more risk-free. I'm not absolutely sure how we do that. We need to perhaps do some work on that, but that puts people off being partners. I think the other thing is, in a way, we have to big up partnerships, because I think there's been a lot of people saying bad things about general practice in general, and I think it's the absolute best job, I think, in the world, and being a partner is really part of that. So a lot of the work I've done has been possible because I'm a partner. I've developed lots of different services because I've got a sort of ownership of it, and that we need to stress how good it is, I think.
You're a public figure now. MPs get a lot of abuse. I mean, GPs are used to getting abuse in the media, and unfortunately from some patients as well in recent years. But generally, doctors are held quite high in regarding those lists of professionals that people trust and respect, and MPs, along with us journalists, right down the bottom. How have you found that? I mean, do you feel that people treat you any differently now that you're an MP, or have you had any bad reactions from the public?
Oh yeah, God, no, it is interesting, because I joke with people. So I've gone from the highest to the lowest, and it's really noticeable in your sort of post bag, if you like. So I get a huge amount of abuse, quite unpleasant actually, in emails and stuff. People are just horrible about me in some ways, and that never happened as a GP. And the other thing is, when you go on radio and stuff as a doctor, you get it's not an easy ride, but people are sort of on your side. You go on the radio or TV now, they're trying to catch you out, and they're really up against you. So it's a much tougher gig, if you like, as an MP. What I've done with the social media side, which is where you get a lot of abuse, is I actually do it at arm's length. So I've got a social media team, and I just don't read some of the stuff because it is so unpleasant. And a lot of MPs get really nasty stuff. Some of it's actually really unpleasant about, saying that they're going to get got and, all sorts of horrible things like that, and the police have to get involved. I haven't had anything like that. But, for example, the day after I was elected, someone chucked a stone through our window of our office and that sort of thing. That doesn't happen in general practice either. Well, not in my general practice anyway, so...
We've talked a lot about general practice in the NHS, but you stood for election on a platform based around the NHS, clean energy, housing and inequality. What else are you hoping to achieve in your time as an MP?
I think if I had to choose two things, it would be the NHS and climate. They're my two biggest passions. One of the things that I quite like about this government, so for example, the NHS is about healthcare, but one of the things about the NHS is we've got to make it as green as possible. So we have to make it as carbon neutral as possible. And that involves lots of different things in just simple healthcare. Involves healthcare as well. So instead of getting someone up for multiple blood tests for their diabetes and then for their chronic kidney disease and all that, you want to get them up once because that is much better for the planet. We need to be careful with our pharmaceuticals because that costs a lot. So there's lots of crossovers between departments. So like this morning I was talking about active travel, which means walking and cycling essentially, and that's really good for the road system. It's really good for climate and emissions, so our air is cleaner, and it's also much better for people's health, so we lower obesity. So there's lots of cross-cutting things which I find really exciting. So I go to lots of different committees and go, oh, that links with that. I'm also quite passionate about creativity. One of the things that the health department is doing, which I think is really fantastic, it's about concentrating on prevention. And one of the things that I've taken from that is, how do you prevent mental ill health? And one of the ways you can prevent mental ill health is to involve creativity and culture. And so that's a different department again. So there's a lot of cross-cutting, and I sort of see myself as going across so many different departments that I find really exciting.
If there's any doctors listening to this or anyone listening to this, what advice would you give to other GPs thinking about branching into a career in politics? Would you recommend it for a start?
I don't know. Ask me in a few years about that. I mean, I think you do get a feeling that you are able potentially to influence things on a bigger scale than you can as a GP. I think my first bit of advice is come off all social media, because your social media will be raked through if you go into politics, and anything you put down even 20 years ago will be brought up. And I think also I would encourage people to do it. I think doctors are in a really good position because we tend to know, you get a real good slice of life as a GP. You really find out what's happening to benefit system, what's happening to about housing, what's happening about the health service, etc. So yeah, I would say get involved, but sort of get a crash helmet as well.
All right, that's brilliant. Thank you very much for your time, Simon. I really appreciate it.
It's all right. No, it's been a joy. And as I say, if people want to contact me with ideas, I'm very happy to accept them. I am here for the NHS to try and improve it, because I love the NHS, and I think we all do, and it's in a bit of a sorry state at the moment. Yeah, well, I'm really hoping that we'll start to see some improvements over the next 5 years as well. Absolutely, and I will guarantee that. I'll make sure that happens. Oh, brilliant. Thank you very much. Thank you. Well, that's it for this week. Thanks so much for listening, and thanks to Simon for speaking to me. I'll be back next week with Nick for our regular news review, so please do join me then. In the meantime, don't forget you can keep up to date with all the latest news affecting general practice and access a wealth of other resources and information on our website at GPonline.com.